everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Risedronate. Its brand name is Actonel. Now before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So Risedronate binds to bone hydroxyapatite. At a cellular level, it inhibits osteoclast activity, and this gives it the ability to modulate bone metabolism. In terms of indications for use, this medication is indicated to be used in the treatment of osteoporosis from a couple different causes, and it's also indicated to be used in the treatment of Pagets disease. Now, before somebody was to use Risedronate, there are some contraindications that they must clear, as well as some precautions and warnings that they should be made aware of. This medication cannot be used by patients who have esophageal abnormalities that may delay esophageal emptying. If a patient had a hypersensitivity to Risedronate or any other component of the product, they would also not be able to use this medication. Patients with hypocalcemia or low calcium cannot use Risedronate. And finally, it cannot be used by patients who have the inability to sit upright or stand for 30 minutes. Now, in terms of precautions, it's not recommended to use this medication with H2 blockers or proton pump inhibitors. Hypocalcemia or low calcium has been reported with the medication, and if a patient does have hypocalcemia prior to initiation, they must correct this before starting the medication. It's a good idea to avoid the use of this medication in patients who have Barrett's esophagus, as there may be an increased risk of esophageal cancer. Patients should be told about some of the adverse esophageal events that may occur with the use of this medication. Some of these would be esophageal strictures, ulcers, esophagitis, and sometimes erosions that include bleeding. Osteonecrosis of the jaw has been reported. This is typically only seen after an invasive dental procedure. Severe musculoskeletal pain has also been reported. This can happen anywhere from after the first dose to after months of therapy. Atypical fractures of the femoral shaft have been reported. The use of this medication is not recommended in patients who have severe renal or kidney impairment. And it should be noted that some mental disabilities may make it more difficult to properly administer this medication, which could lead to more esophageal adverse effects. Now, once somebody is cleared of the contraindications and made aware of the precautions and warnings, and they start to use Risedronate, they can expect to receive their dose orally. If somebody is using this medication to treat osteoporosis, they would typically use 35 milligrams once weekly. The medication should be taken with a full glass of water and typically taken about 30 minutes before the first meal of the day. Oftentimes, while using this medication, patients will also receive calcium and vitamin D supplementation. If somebody is using this medication to treat Pagets disease, they would typically use 30 milligrams once daily for 2 months. Again, the medication should be taken with a full glass of water and about 30 minutes before the first meal of the day. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Risedronate, so I'll go over some of those here now. 8 to 11% of patients may experience a rash. About 12% of patients may experience abdominal pain or constipation. Diarrhea and indigestion happen about 10% of the time. Nausea can happen up to 13% of the time, and up to 28% of patients may experience a backache. A urinary tract infectious disease and influenza-like symptoms can also happen about 10% of the time. Now, some more rare but serious side effects will be a hypersensitivity reaction, joint pain or osteonecrosis of the jaw, or benign prostatic hyperplasia. That's all we're going to talk about today with Risedronate, or Actonel. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.